Hey there, my name is David. If this title catches your attention, it probably catches your attention for a good reason. Um, I guess I'll say first off, because it's difficult to know at what point to come at this. One of the reasons I have something called adhesive arachnoiditis. Another term is arachnoiditis, and I'll explain that in a second. But when you get a shot, when you're pregnant, when you get an epidural, when you get a spinal tap, you could have been in an accident, you didn't know, you got it unwillingly. Like myself, you hit your spine, like you hit your coccyx from it was from a high height. Like I slammed my coccyx on the pavement and I developed it. But with this, in most cases, here's my caution to you. Did you get a cortisone shot in your epidural space, or did you get a puncture? And when you got it, you had such incredible pain from it that you're not the same person today, because you may have a lot of tingling and shocks, but you may have a lot of pain in your legs. And that's what I'm pointing out to you. The reason I'm making this is because, like, I like helping people every once in a while to do something, and I have helped people get their diagnosis of this disease, if in fact that's what it is. So I make this video. I say, pardon me, I'm very uncomfortable, just to let you know, with pain. Did you get a steroid, cortisone, epidural, or spinal tap, and after you weren't the same? You have a lot of pain in your legs, and there's something has changed, or that when you actually got it, you remember something happening. I'm going to give you an example of what I'm speaking about, okay? I live in an apartment building here, and I see a lot of people walking around a lot, and I meet people, I talk to people. And I knew, in speaking to one older woman, who I have now got her diagnosis, helped her get her diagnosis. I remember one day she had been outside walking, just what appeared to be fine, and then the next days, the next weeks, she's using a walker, and immediately I thought, there's just no way this could happen this quick. I asked her all about it, and she was telling me the things that had happened to her in her life, and getting these shots. And another person in my building who I'm trying to help, I know they have arachnoiditis, which is inflammation of the spine, okay? And in my view, it's probably adhesive, but I can't get that person to give me their MRI. It's unfortunate, but anyways, so what happens is, now just imagine this for a second. This is happening to a lot of people. This is an epidemic of this happening. This disease is considered to be rare, but it's probably not. What happens, and the reason for it not being rare any longer, is because so many women and so many people who are in sports, who are in this or in that, get these cortisone shots, get the epidurals for birth and all that stuff, and there's many mistakes that happen. Now I want you to imagine for a second that your spinal canal is just this little thin layer, right? And the place where they have to put the needle is called your epidural space, and we're just, we're talking about millimeters here. You can go read on the internet, and there are cases where, nurses give it, and I don't know, it's not always doctors, and you hear of horror stories and saying like, oops, they slipped a bit. If they slip a bit, they can go right into your spinal canal. And so what happens is, like with me, it was blunt force trauma, but can you picture the tip of a needle going through the spinal canal, and what happens is it punctures through it, and what happens is that causes inflammation. And this is a progressive disease of the spinal canal through adhesions, which are scar tissue. It's progressive scar tissue. So once that inflammatory process begins, it just keeps going and going. And it begins off with inflammation of the spine, which is called arachnoiditis. That's what it means. Arachnoiditis sounds like a spider web, right? That's why they call it that, because on a microscope it looks like a spider's web, all the adhesion in the tissue. And so adhesive means that you have all that. So you have your nerves, in the middle of the canal, and then scar tissue builds around that, and it gets to the last stage, which is called adhesive, which means that scar tissue that's attached to your nerves gradually attaches to the canal itself, and then you can be a lot of pain then. Pardon me a sec, I'm going to finish this off. I have to take little breaks because it's difficult for me to speak, and so I'm going to offer you something. Just one sec. Some people were good enough to me once I got on to suspecting what this was, and people were like, well, you have to go to this person. They gave me the email address and stuff like that, and I contacted. There's a doctor in California. His name is Dr. Tennant from the Tennant Foundation, and I do have a line to him if I want. And so no, I don't think I'm special or anything because of that, but he told me that if you have any other cases, you can bring it to me. So that's what I'm offering. If you are if you're in a spot where you got that and you got an injection, all of a sudden you're in a lot of pain after that, there might have been something wrong. But hey, if you're having difficulty walking, if you have progressive disability in your legs, or you have a lot of burning pain now since that, you should be at a stage where you suspect it's better to look. So what I can do for you is I can contact and say, I know someone who needs help, but I need your MRI, and I'll probably need to speak to you yourself by email, but I have to make it clear that I don't put up with people with drama and stuff like that. I'm just looking to help someone because I think it's good to help people. And I know what it's like. I went 13 years not knowing what this was. I hit my spine, and within 6 months, it was very difficult to walk, and within a year I couldn't walk. And I went 13 years because I didn't have an MRI on my spine. And even if you get an MRI on your spine, they may not diagnose it. In most cases they won't, because the radiologists are not trained to look for this. I believe they would probably, some do, but most don't. It's a very unfortunate thing. And but I'm sure that also like you can see it on an MRI yourself, and he will point it out. He'll put arrows to it for you to show you where the scar tissue is. With mine, it's about halfway across the spinal canal, and sometimes the scar tissue goes all the way across. But I have a lot of burning pain in my legs. It's the worst pain disease that there is, and sorry, I don't mean to make it seem so bad, but your legs burn. It feels like there's boiling oil over your legs. You get a lot of stings, like scorpion stings, a lot of cramps. You can wake up and sleep with massive cramps in your legs, and a lot of lower back pain. And another reason this happens is from failed spine surgery. So that's my offer. Yep, so I'm willing to help you to try to get your diagnosis. Also, you can check a video. It's about 2 videos ago that I made. I am willing to train through support and coaching people with intractable pain disorders. I have 12 different pain disorders myself. 4 of them are pain suicide diseases, so I know what it takes to get through pain, through exercise, through diet, through sleep, through all that stuff if you're interested. But I do charge for that. But for this, I want to help somebody. So if you're in a spot where things are unmanageable, I'm willing to talk to you. So I'm going to leave one of my emails in this. If this is you, if you got one of those shots and this is happening, and you suspect that this is what it is, remember the name. Arachnoiditis is how it begins, which means spinal inflammation. The next stage, it goes to adhesive, which means that scar tissue has stuck from the nerve to the canal wall. And that's called adhesive arachnoiditis, which is the final stage. And it's quite painful, but it's better to get this looked at right away. So if that's you, let me know. I don't put up with people who try to screw around with me. Thank you very much.